This is an explanation question and we have to reconcile the discrepancy in the argument. There is no conclusion in the argument and the missing link is between the improvement in the treatments that prevent mobility limitations and an increase in the proportion of cancer patients who suffer from mobility limitations. Our broad expectation from the correct answer choice is that it should explain why there is an increase in the proportion of cancer patients who suffer from mobility limitations when the treatments of preventing mobility limitations have improved. Answer choice A. This answer choice talks about the effect of chemotherapy treatment on musculature and says that the musculature is unprepared for normal activities. So this answer choice supports the fact that after chemotherapy, many cancer patients go through mobility limitations. However, this answer choice does not suggest why there is an increase in the proportion of cancer survivors with mobility issues when the treatments for the prevention of mobility limitations have improved. So this answer choice is just additional information and does not explain the discrepancy in the argument. So let's eliminate this answer choice. Answer choice B. This answer choice talks about radiation therapy and says that this therapy results in less damage to musculature. If this is so, it indicates that because of this particular therapy, with poor musculation, which would lead to mobility issues, this proportion should have gone down. However, the argument mentions that this proportion has increased. So this answer choice, in simple words, raises further concern over the discrepancy rather than resolve the discrepancy. So let's eliminate this answer choice. Answer choice C. This answer choice talks about improved medical technology and says that because of this improvement, cancer patients are now more likely to survive. It also says that because of this improved medical technology, the cancer survivors are more likely to experience mobility issues. So overall, this answer choice indicates the possibility that even with improvements in the treatment for preventing mobility limitations, cancer survivors are more likely to experience mobility issues. Such a possibility explains why the proportion of cancer survivors with mobility limitations has increased even when the treatments for preventing mobility limitations have improved. So this answer choice explains the discrepancy in the argument. A good answer choice. Let's keep this on hold. Answer choice D. The argument mentions that the treatments for preventing mobility limitations have improved, whereas this answer choice says that this improvement is gradual. Even if this is so, this answer choice does not rule out that there is an improvement. So this answer choice raises further concern over rather than explain why the proportion of cancer survivors that suffer from mobility limitations has increased. So let's eliminate this answer choice. Answer choice E. This answer choice states that mobility limitations caused by chemotherapy can be controlled but cannot be completely prevented. So this answer choice says that some mobility limitation would exist in cancer survivors, but again, this answer choice does not explain why there is an increase in the proportion of cancer survivors who suffer from mobility limitations when the treatments for preventing mobility limitations have improved. So this answer choice fails in offering an explanation. So let's eliminate it. C is the correct answer choice.